prostate cancer is in my family. My dad actually died of prostate cancer. So I've been very vigilant about getting my PSA checked yearly. So it had been creeping up, and once it got above 4, my primary care physician got concerned and referred me to a physician in Lakewood where I live. That urologist did not take Blue Cross Blue Shield for some reason. So I talked to my sister who had used Dr. Trotter, and she said he was a great guy. So that's where I started. So when I came, did, basic checkup and was decided to do a MRI to see if the MRI would show anything. The MRI came back positive, so then it was decided to go to the next step, which is the biopsy of the prostate. Dr. Trotter did that here in the office, and that confirmed everything with a PSA of 4.3, so moderately aggressive. Cancer reading of 4.3, moderately aggressive cancer, and Dr. Trotter at that point went through all the options, all the kinds of radiation that we might consider. And based on my age and the fact that radiation is probably only a really good, a good treatment for 10 years, it was decided that I should do the radical prostatectomy, and that's what I decided to do. A lot of nerves leading up to it. I was having trouble sleeping, and actually had Dr. Mazzarella prescribe some Ambien for me for the last 5 or 6 days before the surgery, because he wanted me to have lots of rest beforehand. And so with the help of the Ambien, I slept well, and actually day of surgery woke up and drove myself to the surgical hospital, and my wife was going to come and meet later. The pre-op for the surgery was, all the surgeons and the anesthesiologists, everybody came through and talked to me beforehand, trying to answer any questions and all that. And the surgery itself was a breeze. I mean, I think it only took about 2.5 hours. And I woke up, and apparently I don't have much problem with anesthesia, because I woke up and felt fine. Spent one night in the hospital, went home the next day, and really never took anything more than aspirin with codeine for the pain. The most irritating thing is having to wear a catheter for a week or so. And other than that, honestly, the recovery was not bad at all. And I was up and walking the neighborhood, pretty much the day I got home.
Perfect.
Everything's fine. Sexual function came back actually in only a month for me, which was apparently pretty unusual. I wore a pad for a couple of days, and then have had almost no problems. Apparently I'm very lucky, and so I really, honestly, quality erections are not quite as good, but with the help of a little Cialis, it works fine. And overall, I really feel pretty normal again.